Welcome to my channel, Pajon Imaging Hub. On our patient education series, today we will look at hysterosalpingography, also called HSG, what the patient needs to know. Please remember to like and share this video to help us in our effort at educating the patients. Also, click the subscription button to subscribe to this channel to be notified when new video is released. We'll look at HSG under the following heading. What is HSG? Why do we do HSG? Preparation for HSG test. Materials may be asked to provide for the HSG exam. What the radiologist or radiographer actually do. How the result is interpreted. How they arrive at their findings. And also look at care after the HSG. Are there drugs you have to take? Now, what is HSG? HSG is the X-ray examination of inside of the womb and fallopian tube using contrast media, which we call dye. Also, this picture shows us the womb. This white thing is inside the womb. Then we can see this tiny line is the tube. See this tiny line here also is the tube. Also, this is the end of the tube. Then we'll see outflow of the contrast outside of the tube. This one, the same occurs to this right tube, the outflow of the contrast outside of the tube. So the contrast or dye help us to see this inside of this womb, this white thing, and how it shows the tubes and then flow out of the tubes. This is a normal HSG. It shows us that the womb is fine and the tubes are open. This is how HSG image look like. So we'll look at the reasons for HSG. We do HSG basically for two reasons: to check for infertility, people that are having difficulty in conceiving, and also in case of myomectomy, to remove fibroid or tumor from the womb. We do HSG before such surgery and after the surgery. Before the surgery, to check the state of the womb and the tube, and after the surgery we'll do HSG to check the state of the womb and the tube also, to know whether the surgery have affected the womb. We'll need some materials for this procedure. These are the materials we use for the procedure. This is the water for injection. This is cotton wool we used to clean things. This is sanitary pad we used to clean the patient, and this is syringe and needle to draw the dye and inject to the patient. Then we'll have this is buscopan injection to relax the muscle. Of course, we have the glove for the operator to protect his hand. This is a normal saline to use to mix with the contrast before injection, and also to clean some other things. Then this is the dye, we call it contrast, that we use to inject into the womb to show us the womb and the tube. We also look at this is a methylated spirit for cleaning of the surface where patients are meant to lie, and this is Savlon for also cleaning. Then we use Savlon to clean our materials and also the patient. This catheter and scalp needle for introduction of the contrast. Then there are some instruments we use for HSG. We have this is sound. This one here is sound. We use it to check the length of the cervix and also the direction of the uterus. That is the womb. This one here is, there are cannulas, different sizes. We use it to introduce the dye inside the womb. This one is forceps is a tissue forceps. We use it to grip the cervix, the anterior lip, so that we can pass this cannula inside. Then this is scissors. We use it to cut things that we may need to cut. Then we'll have this is a gallipot. We'll put the contrast inside here and then draw it from here. This one is a catheter introducer. It helps us to introduce catheter inside the womb through the cervix. Then we'll have this. This is a speculum. It is used to open the vagina so that we can have a visualization of the cervix to be able to locate the opening of the cervix. This is still the same speculum, closed. You open it. This is a closed form. Then this is sponge holding forceps. This one here. You use it to grab a cotton wool to clean the patient and some other things. Then this thing here is the dilator for patients that have a cervical stenosis or narrowing of the cervix. It comes in different sizes. We put it through the cervix gradually to dilate the cervix so that the instrument we want to insert through the cervix can easily enter. Let's look at how the preparation we do for HSG. Now, in choosing of date for the test, there are things we put into consideration. We don't want to do the test when the inside of the womb is denuded or engorged. Denuded in the sense that during menses, the layers, the surfaces of the womb is shed, and that is what flow as menstrual flow. Immediately after the menses, these layers has been shed. We don't want to introduce any media or contrast or dye inside. The womb is still, or rather the inside of the womb is not in a good state for such a thing to be done. Then also, before menstrual flow, the inside of the womb become engorged. What is going to flow is the surface, the surface of the inside of the womb. These surfaces will flow out. That time it becomes engorged, just sticking like this. So we don't want to introduce contrast or media into such a situation. We're going to have a lot of resistance. So HSG is done in such a way that we avoid these two periods in the patient cycle. So most cases we do HSG between 8th to 12th day following the commencement of the menstrual flow. It varies in some centers. Some centers can do, some do even 13th day, some do even come down to 7th day from the start date of the patient menstrual flow. We also put into consideration the length of flow of the menses. Patients that have shorter menstrual flow, in such a patient, we can do such test maybe in day 7 or day 8 or day 9. But for patients that have a longer flow, we can do the test probably in day 10, 11, 12 or thereabout. So we'll consider that also, depending on the length of flow. Or even in day 14 if the flow is longer than expected. Once we book for HSG from the start of the menstrual flow to the date appointed for the HSG exams, we advise patients to abstain from sexual intercourse. The reason is just we don't want a situation where we disrupt a normal pregnancy that may have taken place. Now the patient come for exam for infertility test does not mean that the patient cannot take in at any time. Also, um the morning of the exam, we advise patient to visit the toilet before coming, to make effort to poo so that there won't be collection of fecal matter towards the rectum. That may give us some opacity that may confuse us with what we'll expect to see in the exam. But there is no need for fasting of or normal bowel preparation. We normally give for some other tests we do in radiology department where we expect the patient to be on light diet for 2 or 3 days. That case is not applied for HSG. We just want the patient to come that morning, preferably fasting, but it's not a must. For patients that cannot fast, they can eat that morning. But when you come fasting, it makes you to be comfortable, especially during the procedure. But you can eat if you cannot um, tolerate that fasting for that morning before the procedure. Then patient on medication advised to eat and take their medication. Food is not contradicted before HIG. We advise the patient to shave at least 4 to 3 days before the investigation so as to make the surface clean. Let's look at the HIG procedure proper. When the patient comes for this procedure, the radiographer or radiologist asks the patient to lie on the table, a special table, the X-ray table, in a lithotomy position. That is the same thing as delivery position, with the leg open. The radiographer or the radiologist cleans the surface of the vagina using the Savlon with the normal saline, and then insert the speculum through the vagina. Insert it to open the vagina so that we can see this opening of the cervix. Then we use sound to put through the cervix. I've shown you how the uterine sound look like. Then we put it through the cervix to check the length of the cervix from this to here. And then we can check the direction of the womb. Then after that, we use the speculum to open. Then after that, we use the tissue forceps to grip the anterior lip. What we are seeing here is the posterior lip. This tissue here is the posterior lip. So this is a diagram. So the anterior lip is supposed to be at the anterior aspect, that is the surface. So we use the tissue holding forceps to hold it, to grip it. At this point, the patient feel pain, and there could be mild bleeding. Now hold the anterior lip so that we can have easy access into the cervix. The cannula is then introduced into the cervix. If we are using catheter, we use the catheter introducer to introduce the catheter through this opening into the womb. We can now inject the dye into the cannula to outline this inside of the womb and to trace this opening, and we expect, if here is open, for the contrast to flow out freely. Now remember that this is the ovary. This is where the egg is being produced, this place. So once the egg is produced, it enters and release. It enters through this tube and move down. As it's moving down, and sperm is being introduced, it meets it, the sperm fertilizes the egg, and they get implanted inside the womb. So the HSG is to show us whether these tubes are well open, so that if the egg is released, it can move easily through the tube. Or to show us why conception is not taking place, what could have been the cause, whether the tube is closed. Series of injection of the dye is made and series of films are taken. During this injection, the patient feels mild to moderate pain depending on the state of the tube. If the tube is closed, the patient tends to feel more pain during the injection because it is forcing of the fluid against resistance. After this injection and taking of films, the patient is asked to wait for 30 minutes to check for absorption of the dye that has been injected into the womb and also to assess some other condition of the womb. Then after that, the patient is discharged. Then this is important. The patient may start seeing blood in the urine a day or two. But if this should not be a case for concern. But if it persists beyond fourth day, then the patient can report back to his caregiver. Then the patient is also asked to take analgesic if need be to help control pain. Then as soon as the patient return back his normal comfort, she can resume her normal sexual life. And of course, the beauty about HSG is that it is both a diagnostic tool and a therapeutic tool. It is possible that what has been inhibiting or preventing pregnancy is just a little closure of the tube, which could be forced open by the injection of the dye. So after HSG, research shows that there is increase in chances of patients becoming pregnant. So let's look at some of the images to see what we normally see from HSG examination. This is the first image I want us to take a look at. It's similar to the image I explained before. This is a normal HSG image. The tubes are well outlined. This is the cervix, this is the inside of the tube. Now you see this small tiny line. That is the tube. Then reaches here. This is the end. Then we see free flow of the dye outside of the tube. We also look at this other end, the right tube. We see how it traces it at the end. We see the free flow of the dye outside of the tube. This shows that these tubes and the womb are patent. That means they are open, they are normal. Then we look at this other one. This other one is similar to what we have seen. We see the cervix, and then we see the womb outline. Then we see the tiny line that is the tube. Then we see the end, how there is a free flow of contrast outside it. We also see this other end. This is the tube. Then we see free flow of contrast or dye outside it, showing that the tube is open and the womb is normal. We'll see this other one here. We'll see the womb shown. Then we'll see this structure here. That is the tube. But we're not convinced whether there is free flow out of this tube. We also see this tiny structure here, which could be, and came out of here, which could be the left tube. We're equally not convinced that this tube is in normal condition. These are cases that can be encountered in HSG examination. Then we'll see this case here. Yeah, this is an interesting case. This is a case of hydrosalping. Yeah, we see the cervix here, and we see the womb shown. We see this tiny dark spot there. That could be, we call it filling defect. That could be air or fibroid. Then we see this tiny line that move out of here, and this big loop. That is the tube. It is a dilated tube. Hydrosalpine is a tube that is distended with fluid, and this fluid could be water or pus. Then we'll see this other, the right tube here. You can see this is the right tube. It is moderately smaller compared to this, the left one. And it goes this way, and it appears to have some free flow here, but it's not that wonderfully shown. So this is a case of hydrosalpine of the left tube. The right looks comparatively normal. Then we'll see this case here. This is the cervix. Now this is the inside of the womb. Now we see this structure here, a tumor or fibroid inside the womb. Now we could not make out any tube from this womb. We didn't see any tube. So it's a case of fibroid and the tubes are closed. Then we'll see this other tiny one here. This structure is the cannula we use to introduce the contrast or dye. Then we see this tiny thing is the cervix. Then we see this is the inside of the womb being shown with the dye. But this dark area are sign of tumor or fibroid that have distorted the shape of the womb. We could not make out any tube from this HSG image. This is a case of intravasation. We see they use catheter for this case. You see this tiny line is the catheter. Then this is the womb. But then we see so many things outside here. These are the dye entering the blood vessels. This could be a case of doing HSG when the uterine cavity, the inside of the womb, have not just recovered to some good extent. It may have been done closer to the menstrual flow. We see this other case here. This one here. This is the cannula we used to introduce the contrast. This is the cervix. Then this is the womb. We can make out some tiny things that come out of here and they flow out of the tube. That is the tiny thing is the tube. This is the flow out of the tube. Spillage. That means there is a free flow. Here we can make out something that is coming out from here and this, but we'll have so many other lines that we're seeing. These other lines are confusing. They are also a sign of intravasation, entering of the contrast into the vessels, which could also be as a result of doing the HSG at the wrong timing. Now, when such a case occurs, if we'll we'll halt the procedure and allow for some time, 30 to 1 hour, so that those dyes or contrast can be reabsorbed back into the body and the clotting takes place to close those openings of the vessels so that contrast will not easily enter the vessel again. This is also a similar case of the same intravasation. See, we can't really make out anything definite from here, even though there are signs of this looking like the tube and probably spillage, but we're not sure because it has been messed up by the dye that enters the vessel. We see another case here. This is a womb. Then we see the end here. There is it did not continue to show us the tube, so it closes at that end. Now, whenever the tubes are closed, it could be a case of spasm where the tube on its own closes because of the discomfort of injection of the contrast and pain being felt by the patient. That is a false closure of the tube. It doesn't mean that the tube is closed. And that is why we advise the patient that during HSG, even though they may experience some pain, they are to try to feel calm. Also, Buscopan is being given before the introduction of this dye to also help to feel more calm during the procedure. Now, this is another case. We can see the womb being outlined. This direction we could not make out the tube. It ends there, so there is possibility of the tube being closed. That is not patent. But this other one we can see the tube, but there seems to be loculation of the contrast is not free flowing. This could be a case of adhesion, which could be caused by infection. So these are the common appearances we see during HSG procedures, and that is how we arrive at the diagnosis. Thank you so much. Please don't forget to share this video and also to click the subscription button to subscribe to this channel so that you'll be notified when new video is released. Bye for now.